The following is a demonstration of new functionality for SER 8719. In this demo, we will discuss the new sexual health related reminder and changes made for sexual health education providers. To begin, let's go ahead and open up a case and take a look at the new reminder. Opening the client notebook, notice that the focused child is 11 years old. Clicking on the Open Reminder button, there is a new reminder called Discuss Sexual Repro Rights and Barriers. This is an annual reminder that will be generated when the client has not been informed of their reproductive and sexual health care rights. The due date of this reminder is 1 year after the latest of one of the following: the case start date, if the case has no closure history; otherwise, the first approved in effect case plan after the most recent case closure; the latest associated service after the above date with a service type of informed sexual and repro health rights; the client's 10th birthday if the case does not have any closure history. Note, the reminder will always show 1 month before its due date. To satisfy this reminder, let's head over to the Associated Services tab in the Contact Notebook. In the Service Type drop-down, we will select Informed Sexual and Repro Health Rights and add the child as a service recipient. Now, when we open the reminder dialog box, the reminder is gone. Now let's take a look at the changes made for sexual health education providers. First, let's do a search for a sexual health education provider. Since we already have an associated service row for sexual health education service and a sexual health education provider is selected, we can try to open this provider. Notice that the ID page and address page are read-only. Now, let's try to merge sexual health education service providers. First, let's do a search for a sexual health education provider. When we open the Merge Service Providers dialog box, in the Service Provider 1 drop-down, you see that no sexual health education service providers are populated in the list. When we select the drop-down for Service Provider number 2, again, there are no sexual health education service providers populated in the list. This is because sexual health education service providers cannot be merged. As you have seen, we have looked at the new Discuss Sexual Repro Rights and Barriers reminder, the Service Provider Notebook, and the inability to merge sexual health education service providers. So that concludes the demo. Thank you.